Wait, babe, do you see what this says? It says trust your vagina with thank you. Oh my God.
What is up, everybody? We're at 40 weeks. She's about to burst. So this week we're going to tell you what's going in our hospital bag.
Come with us and we'll show you.
All right, baby doll. So it is getting real up in here, right?
Up in here.
Okay, so we're at 40 weeks, and
this week is our 40 week.
Oh, so my take on this is that Anastasia's nesting has been like going into the 5th gear. So
I have been cleaning.
Anastasia's been rearranging the house. There's been cleaning. She's been
nesting hard.
But then now, usually I would say you're in control of pregnancy. I would say now the pregnancy is in control of you.
Oh my God, for the past couple of days, it's been so, I would say maybe the past 2 days, it's been very hard to walk. If I sit for too long, it's hard for me to move. If I lay down for too long, it's hard for me to walk. So my hips and my thighs and my legs are like giving up on me.
So like last night, for instance, she gets up, has to use the restroom, and she's been laying too long on her hip, and when she gets up, she almost collapses. So I'm carrying her to the restroom like this because her hip is collapsing on her. It was crazy, and I felt like got her to the restroom, and I'm waiting outside the restroom, worried that you're going to fall off the toilet. So we're at that stage now where body is starting to break down, and then we realized we don't have our bags packed.
We had everything like laid out. What should go in the bag for the baby, what should go in my bag, what should go in his bag.
No, I didn't have anything packed in my bag. I just figured once the water broke, I was just going to grab some underwear and some shorts and run.
After how I've been feeling, like Christian said for the past 2 days, yes, it's time to just pack the damn bag.
What we're going to do today is going to show you what's going in Anastasia's bag, what's going in the baby boy's bag, and then we'll just throw what's going in my bag. No one really cares about what's going in my bag. So
hey, he's part of it. He's staying with me. So far, so good. He could still stay with me in the hospital. If they call me and say Anastasia starting on Friday, spouses will not be allowed to come to the hospital, guess what I'm doing? I am going in to get induced and get baby Anderson out. But God knows, I want my husband next to me.
And last time you went, you checked, and baby boy's like this.
Baby boy is like that. Baby boy is ready. Baby boy is low.
He's all like Wakanda right now in the womb. He's just like this, tucked in. The ultrasound couldn't even get his face because he's so tucked in
ready
and just ready to roll. So we're on baby watch for sure.
Any hard activity, he is going to show up, and we don't want him to start coming out in the house. Listen, when God said he's ready, he's ready. Okay, we can't control that. I think last week I didn't mention how I have non-stress tests every week. I had biophysical tests and everything, and they're always like, did you feel that contraction? That looked like it was a hard contraction. I'm like, well, I did feel something, but I don't know. Listen, this is my first child, and they always say first child is hard for you to know what contractions are. I feel them here and there, but sometimes when it's really a hard one, because, you know, when you listen to so many women, they said it's so painful. And so I'm like waiting for that painful moment. So anything I can control to me is not painful enough. So the doctor is like, that was a contraction. Did you feel that? I'm like, no. That was a really hard one. Did you feel that? I'm like, yeah, but it wasn't hard enough. That's not what a woman are telling me. So, okay, now I'm not listening to any of you.
All that to say is that she could be having contractions and not know it, and all of a sudden we're going to look down and baby Anderson is coming out. So we are having our bags packed. So let's go show you what's going to be in these bags.
First, I am just going to have one bag, you know, the carry-on bag with a zipper. One side is going to be my stuff, and on the other side is going to be baby Anderson's stuff, because I don't want to have 2 bags. This is not moving it. This is not the dorm, okay? The first thing I'm going to show you is what came in this box, okay? This was very good. This was on our registry. Everything I'm going to show you is from this box, and it's the Freedom Mom Postpartum Recovery Essentials Kit. Trust us, your vagina would thank you. So everything in here is supposed to soothe you after the baby. It's for postpartum after the baby. Comes with this underwear, boy shorts underwear. I heard it's really good. 2 of these. It's a cooling therapy pad. So it's basically a double date for your vagina. So I guess I read the instructions, you pop it, and then you put it down there to kind of soothe you. I heard it's really, really helpful. I have the perineal pad liners. So this also came with a pack, and I heard it's really, really good to use. Everybody has been telling me to get this healing foam. These all came in the pack. So this is really good. This pack is really good. I haven't used it ever before because this is our first pregnancy, but I will let you know once we are done if it was helpful or not. Now that we're done with down there, I'm bringing my pad, because once you have the baby, you know that you do bleed and it takes a couple of days. So I have my pad, I'm bringing it with me. They have someone in the hospital, but I'm just bringing my own to be on the safe side. Some extra underwears, comfortable underwears for myself, even though the boy short comes with some, but I just wanted to pack my own underwear. My nursing bra, I've been wearing these bras for the past 3 months, okay? But these are really good. The maternity stores were closing, so I went in and I bought so many of them. So I'm bringing 2 of it. 2 socks. Everybody's like, you need socks. So I'm bringing 2 socks with me. My shoes to walk around the hospital. If you know me, I don't like to walk barefoot anywhere, even in my own house. Now we're gonna go to the breast area. So I have these little breast pads for leakage. I've never breastfed. I'm not sure how long it's gonna take for my breast milk to come in, but I'm bringing these just in case the breast milk comes in right away and I start leaking in the hospital. So I'm bringing about maybe 5 or 6 of these. I also have this thing. It's supposed to cool your breast, like when it's like really hurting you. You put it in one of these, and then you put it around your breast, and it's supposed to cool down and kind of calm down your breast if it's hurting you. I have a nipple cream in case baby Anderson goes too hard on my nipple. We have a nipple cream. This sounds so funny because I've never had a kid. I don't know what could happen, but I'm planning to strictly breastfeed. So I have so many things for the breast in case it hurts, in case he bites me, things like that. Now I got this from Target, and it's just a simple thing to wear, wear like pants. So it's easier to also breastfeed. So you pop it open, and then you just breastfeed the baby. So I have 2 of these. You thought I was gonna forget my hair stuff. Got my hair all done, so when I go like that in the bed, on the bed, it will not mess up. I'm not wearing no wig. This is it. This is it. This is it. I have my head things to kind of put on my hair before I go to bed. I'm bringing this in case I just want to put it right here, in case I don't feel like laying down these edges. I can always put this on. Did you think I was gonna forget my African scarf? Just in case, my hair is all messy after the 2nd day, I can just wrap my hair and just be comfortable. I am bringing 3 of these. You probably have seen me, I wear these a lot. It's very comfortable, just throw on and go. One might be, coming home, and then the other 2 just wearing it there. It's very easy, just throw on, and it's easier to also pop my breast out and breastfeed. 2 pajamas I got from Target as well. It's very soft, and it has the button, so it's easier to kind of open up if I need to breastfeed. Like, I'm trying to make the breastfeeding easier for me because I'm planning to breastfeed. So milk come in already. And I have all black because, again, once you have the baby, there's a lot going on down there. I don't want to be wearing no white, messing up. One is long sleeve and one is short sleeve. So that way, if it's cold, I have something to wear. If it's hot, I have something to wear. We will put in the link so you will know where we got all these stuff from. I have my toiletries here. I have my soap, I have my lotion, I have my sponge, and I also have my makeup. I thought I wasn't gonna do makeup, if I can, but I have, my makeup, my little makeup bag over here. I have everything I would need in here. I have my little eyeshadow, my little brush, my Fenty makeup, something simple just to kind of put in my face because, you want to feel refreshed, you want to feel good. And then I have all my hair stuff, for my edges and stuff. I'm bringing like a lip balm. I'm bringing like a lipstick. The reason why I'm bringing, my little pack of makeup is because sometimes you have the baby. A lot of women do say they don't feel themselves, but just a little lipstick and a little foundation makes them feel themselves again. And I like to kind of put foundation in my face when I wake up and I'm not home. I like to just kind of feel refreshed, do some eyebrows because the sister ain't got none. I have my lotion, my bath wash, my toothpaste, my toothbrush, all the toiletry stuff I have. Again, we will leave all the link. I got this also from Target. I've always had this for the past 3 years. It's like my traveling kit. Lastly, for me, I have my iPad in case I want to watch anything. I have my charger, I have my headphones and stuff, so you need something to kind of keep you company if baby Anderson is sleeping and Christian is on the couch. Now let's get to what we have packed for baby Anderson. I don't know where to start, but I'm just gonna start with where the things are. 2 bibs.
I think 2 is good.
Yeah. 2 little socks in case it's cold.
Absolutely. 2.
Hopefully it fits him. And look how cute this is.
Anderson.
Guess what? Because we still don't know his name. And that came with a onesie. So that's cute.
We could call him Anderson, so his name would be Anderson.
That's not gonna happen. This is mostly for pictures. You know, you want to take pictures. What I decided to do is put 2 long sleeve newborn onesies, and then I'll have the 3 short sleeve onesies. And of course,
our friend Art gave us. This is the guy who helped me paint the room because he understands. He spent time in Ohio.
So we have 3 newborn onesies, short sleeve, and 2 long sleeve just in case it's cold. And then we also have 0 to 3 month onesies because we don't know how big the baby is. Last week we found out how big the baby was.
He's a big boy already.
Yeah, but we don't know how big he's going to get between that. Usually they don't grow that much within a week. Usually, but we don't know. So we pack in 0 to 3 months.
I'm 6'6".
Onesie, and then we also pack in newborn onesies. So when he comes, that way we have options for the pictures.
I have a size 16 shoe. This baby might be big.
Well, big and tall is 2 different things. We have this little cute package that our friend April gave me. So it has, it's the Burt's Bead, baby oil, it has a comb, the butt cream for the baby for, I guess, rushes, a blanket, and then a receiving blanket. So we have 2 of these. I'm bringing wipes. I know, they have wipes at the hospital, but I'm just bringing 1 just to be on the safe side. Because guess what? We might use it ourselves. If baby Anderson don't use it, we might use it. I'm also bringing a diaper, size 1, and 1 little newborn as well. Again, we knew how big he was last week, but we don't know how big he's going to get this week. I really didn't pack much for the baby. I don't think so.
He hasn't earned his keep yet.
I think I have more stuff than the baby does. Because listen, there's something up here called breast. We need to take care of it. And then there's something called vagina where he's coming out. We need to take care of it. So I have to have more stuff.
I agree with all this.
Now that we are done.
Nah, we're not done.
No. Not that we are. We done with.
We?
No, not we. There's no we yet.
Now that you all are done, you want to see what I'm bringing?
No. Let's see what he really bringing. Like he's the one gonna have the baby.
This is what's going into my man bag: toothpaste, toothbrush, deodorant, face moisturizer, cologne to smell good, hair product, gotta look good for the little kid, some shirts, long sleeve, short sleeve. We're the Cleveland one for the kids, so we're both gonna be matching with our Cleveland shirts. A pair of pants, another pair of shorts, comfy slippers, Bible, devotional, a bunch of snacks to keep mama happy, camera bag to get some good footage. That's all. That's what's in the bag for mama, for baby boy, and for papa. Our question for you is, what was in your bag when you went to the hospital, and what recommendations do you have for us? Leave that in a comment below.
Are we missing something?
Especially for dads, because there's not that many videos out here for what dads should pack.
Dad need his underwear and some comfortable clothes.
And a toothbrush. We're on Baby Watch. We're gonna bring you along with this. Maybe we'll do some live stuff coming up, so keep on checking back on this channel. Check out our Instagram too for images coming from the hospital. If that pops up, our due date is right around the corner and she's looking to pop. God bless you all. Hit the subscribe button so you don't miss out on any quick updates that come up on this channel. We love you. Stay safe. Wash hands. Stay indoors. Knock the stuff out. Happy Easter if that's what you do. We love you. Peace.
Oh, I almost forgot. Of course, I'm gonna have my robe with me at the hospital.
The queen needs to feel comfortable.